Now that you have done your training for 5 years approximately, or 6 years, you have suddenly decided to quit it. Hello and welcome. This is Deepak Mishra and you're watching 10 Minutes International. In this video, I bring to you Madhi Al-Dayani. If you have watched my videos right from the beginning, you have seen his interview at, I think, 1.5 years back as well. Today, I have requested him to be here because he has taken a very significant and very interesting decision. He has been working as a doctor since almost 6 years now in Germany as a resident vascular surgeon. And now he has decided that he wants to not just be a typical doctor, but wants to move one step ahead and wants to be a teacher. He wants to make doctors better doctors. So with this small introduction, let's move ahead. Madhi, hello and welcome.
Deepak, thank you. Thanks a lot. Oh, thanks. It's a very small introduction, but it's really dear to my heart. I loved it. It's exactly what I want to do.
The introduction is small because most of the people who are watching this, they already know you. They have seen your Instagram, they have seen your YouTube, and people who are enrolled in our courses, they have also seen your videos in the courses. They have seen how passionate you are about learning medicine and teaching medicine.
Yes.
So that's why, from my side, a small introduction, I think, is more than enough. All right. So Madhi, first of all, tell us your experience as a doctor in Germany.
Really nice. I would say that my experience, it's just like life. It's an up and downs. Some of the downs were really hard, but some of the ups were really amazing. I started. So I came to Germany because I wanted to be a cardiac surgeon. That was my goal. That was why I chose Germany primarily, because I heard that I can be cardiac surgeon here, unlike many other countries like Australia, UK, or US, where you have no chance of getting such a specialty. And so I came and I thought in the beginning I need the basic training, basic surgical training, come and try. Mm-hmm. And so I started in general surgery. That was my beginning, the first years. And then on the way in general surgery, I discovered vascular surgery, which I did not really know. Growing up and studying in Iraq, most people are dead by the age of 70. And most of the work that vascular surgeons do starts with 70 or 60 years of old. And that's why vascular surgery is like massively developed in a country like Germany, but it's not existent in a country like Iraq. And so I got to know vascular surgery and I fell in love with vascular surgery because vascular surgery had everything that was not there. Everything that I did not like about cardiac surgery was better in vascular surgery. So the time was shorter to become like self-dependent as a surgeon. It was really innovative because you had the new endovascular arm of surgery where you had a lot of innovations coming in. And yeah, it's like very growing, very fresh, very many young people, unlike cardiac surgery where there are many old surgeons who are not moving. And there is a long line of young surgeons who are trying and waiting to be trained. And so I changed. I decided to go not into cardiac surgery, but into vascular surgery. And then
this experience, I mean, knowing about vascular surgery, even I got to know the depth of vascular surgery after I came to Germany and I started working. Because when I was working in my initial two or 3 years, I think, I was working in a team where I was in orthopedic surgery, but in Dienst, that in the evening duties and all, you used to see vascular surgeries, like you have to be assist the vascular surgeries as well, or you have to see patients with thrombosis and PFOCA, the Verschluss. So that when I saw those operations and everything, then I got some idea that, okay, this is also one good branch and people are very highly reputed here. Like it is considered as one of the very good branches here in Germany. In India, the
Yes.
vascular surgery is considered as a secondary branch where heart surgery, cardiac surgeries are like top, and vascular surgery is not so much. But here, it's very highly regarded branch, right?
Yes.
So, all right. So now that you have done your training for 5 years approximately or 6 years, you have suddenly decided to quit it. Did you not like it?
Definitely has a lot of positive things. Everything in life has positives and negatives, and I think it's about the rewards. Everything that's worth a while has some negative sides, and if the reward worth it for you, then I think you should persevere through the negative sides. It's like training. Training is not like training for body fitness. It's not easy, it's not nice, but if you want the results, then you do it. And it's the same thing. And so let's start like talking about positive things in the system that I really liked. The first positive thing is you can work wherever you want. It's a big country, 80 million people. You can work wherever you want.
Mhm.
And so you don't have to be working like in the south and like have a spouse or friends who are in the north. You can always like go wherever you want. You're flexible. That's a one very, very good thing. The other thing is there is no clear structure or an office or boards who delegate this training procedure. Because of the fact that Germany is a federation, it's a federal system, so every state is responsible for this training. And so they're responsible, but not responsible. It's something in the middle, and that gives you the freedom to move, to change your mind, to do something else. And many people use that, like I did. Like I started in general surgery, and then in a few years, I said, like my chief of surgery said at that time, "Why don't you stay? You'll get here whatever you want." And I said, "No, thank you. I want to go to vascular surgery." And I went to vascular surgery, and not everyone stays with the same ideas and the same minds and same beliefs with them they started training.
Yes.
Like it's a very long training and you change your mind. And in Germany, you have the possibility to change your mind. You can do other things. These are positive things. And there is really one major positive thing about training in Germany, and that is you get paid well from the first day.
Yes, yes, that is about this flexibility of changing your branch and changing your location. This is a major flexibility, major positive, which for especially for foreign doctors. Okay, because foreign doctors don't, because of the language issues, because of they don't know the system well. Sometimes the knowledge deficit is also there, skills deficit is there, so they don't directly get into the higher places, which is like more competitive, and there are lots of applicants for those places. So those doctors land up in the smaller hospitals in smaller towns in the branches, which is not a very highly regarded or very highly like the branch of the choice. But because of this flexibility, they have the option that after some time, after 6 months, 1 year, 2 years, after gaining experience, so they have the opportunity to, when they fulfill all the deficits and are better in that, and they also feel that, okay, now I should move, they do that. In fact, in my case, I started in neurosurgery. It was not a Weiterbildungsstelle, it was just a job because I did not have Berufserlaubnis that time. It was but then in some time I moved to anesthesia because that was a Weiterbildungsstelle. So I was like,
Yes.
oh, at least let me do the Weiterbildung at least. I mean, if not surgery. But then I
Yeah.
had come with the hope and wish to do orthopedics. So as soon as I got into orthopedics, like after a few months, so within 6 months, I changed from neurosurgery to anesthesia to orthopedics,
Yes.
and then I stayed in orthopedics. So this flexibility different countries don't offer. That is one good step. And about the salary, I mean, I totally agree with you that because the training is so long, if you don't get paid well right from the beginning, there, because in that 5-6 years of training, the lifestyle changes, the life status, family status changes. You might get married, you might have a child. So and those things, if you are still living at the like very minimum stipend what different countries offer, that would be too little. I think life would be difficult. So I totally agree with the points that you have mentioned, the positives. Yeah.
Yes.
So now tell me about many people tell me or ask me that the innovations in Germany or the quality work, the standards are very high, uh, from the protocols that they followed and the basic general patient care standards. What do you think about that?
Before we talk about that, are we going to talk about the negatives?
Yes, sure. I
or,
mean,
or should we like talk about it later? Whatever
no,
you want.
we can go. That is one point that we will talk about it. Maybe the sequence is irrelevant. We can talk about the negatives. So, what do you find negative? Because what is important is that you have taken a step to remove the negatives, to reduce the negatives in
Yes.
the system. Okay,
Yes.
and it is very important to first know what are those negatives. So, please tell us
Yes.
about.
Yes, I do think it's just one thing for people who are like hearing and they get discouraged or something. There are many positive things, but you have to know the negative side. Not to be discouraged, but to get prepared.
This.
Because I do think that I came and I was like totally focused on the positive sides. And I had like over the years, I had the feeling like, why did nobody tell me about this?
Mhm.
How did it go like all these years this way? I don't understand. And it took a lot of time for me to understand that it has nothing to do with me. This system has been going like for years. It's nothing new. And the negative side of it, in my idea, is there is nobody responsible for training doctors. So the responsible part is the chief of surgery in every hospital, but nobody controls if the chief of surgery actually trains surgeons. Nobody controls if he does any lectures. Nobody controls if he does workshops. Nobody controls if those surgeons did operate or did not operate. And honestly, maybe you back me up on it. In the end of it, many surgeons come through their Facharzt, like exam of licensing as a specialist, and there are average surgeons or bad.
Yeah.
There are, I don't know anyone that came through these 6 years being like really good. It's everybody thinks here that you do the 6 years to get ready, and then you start being a surgeon.
Yeah,
And
see,
that's something that I'm not really, I don't agree. You don't spend 6 years of your life walking and then in the 6th year or after the 6 years start to run.
Yeah.
What if I learned walking in the first year and then I ran the next 5?
But there are people ahead of you on the lines. That's why if you ran, then where will those people go? So that is the see. I totally. What happened is that when I was in my residency and I used to like I've just passed my FACATS exam recently. So I used to in the first year, second year, maybe first year I was very innocent. I was like doing what was told to me. I was just keeping my head low. But in second year, I started like getting those feelings that why is it not why is it not moving? Like why I'm stuck in
It's
this
not moving.
situation. Yeah.
Yes.
So then I talked to my chef over there. Then what is going on? Like, what do you expect of me? And you tell me what is to be done. Uh, but then I was told that that is a system in Germany that you operate after FACATS. Okay, I was told that, and for few months I had also understood maybe yeah he's telling maybe it may be like that because I was seeing others who were ahead of me and still they were not being able to operate or not operating well. But
Yes.
then I went to another university hospital. Okay, university hospital generally they say that there is less training, less Weiterbildung, and like Weiterbildung not I mean not less Weiterbildung, but less surgical experience. Okay, that is generally a mindset. And smaller hospitals you operate more. But my experience was a little different. This was in University Hospital Halle in Sachsen-Anhalt. My experience was different. There, the residents were I mean, I would not say pushed, but the people who are motivated were given the opportunity.
Mhm.
Okay. So that is what I found special about that place, that they were supporting the residents. Residents were operating. Were even I went there as a third year resident, and I was allowed to do several things which I had not done in my previous training. And so that from that I understood that it is the culture of the hospital.
Yes.
So it is not the, in general all hospital. And when I told them there, like when they asked me that, okay, I mean, when I was new in third year, maybe there were certain things which I could not, and they told me that you already done 2 years, 2.5 years. Why can't you do these things? I told them
Yes.
very innocently that, okay, my chef told me that you do it after fakats. They were laughed. They're laughing like anything. That
Yeah.
so 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 with that I understood that, okay, this is a culture, and you have to find the place where the culture is of training.
Yes.
Okay. Yes. And what you said is correct in general for most people, but there are some people, some institutions. Obviously, see, here, what I always say about this is that we always say that what is not been given to us, but from the
Yes.
mindset of from the chef or the mindset of the team, what they think is that what am I getting from him? Okay. For there can be unfair situations where one can be like that. Okay, he's a good resident. He works very diligently, does everything, but still he's not getting the opportunity because there are other people who are also equally good and have better
Yes.
communication skills, are native speakers, and they're ahead of him, so they will get the chance. He will have to wait. But there are also certain situations where the resident, especially I'm talking about the foreign residents who have language barrier, they are not being able to enter the team properly.
Yes.
They are not been
Definitely.
able, they don't understand the what is required of them. They think that weiterbildung is the birthright, but then
Yes.
that mindset is also wrong. Like, you have to give your initiative and your work. That is why I want to talk to you that since you are working not on changing the culture of the hospital, their institutions are there, they will stay forever.
Yes.
What you are working on, what I understand, is on working, changing the mindset of the candidates, how you should go
Yes.
about it. Right, the system is
Yes.
going to be there. How you should prepare yourself to move ahead on that. So yes, then yeah, this is one negative that you've said about the training. What else? Do you have anything else to any other ideas about what could be better in your view? From the system's point of view, what the resident can do better, we'll talk just a minute.
I don't think it's easy to change this system. This is not a problem of yesterday. So it's in 2005, the German system changed, and the payment policy changed.
Mhm.
And so they started something that they call, I don't know how to translate that, but they started paying the hospital for everything once.
Mhm.
And so that led to, they wanted to reduce the costs. And so that led to a process where hospitals have to treat as many as possible to survive.
Mhm.
And this treatment has to be as short as possible. And
Yes.
so every hospital is under pressure to treat patients as fast as possible. And so, like 20 years ago, older doctors had the time because patients stayed longer. They did treat a lot less patients. And so they had the time to teach younger doctors
Yeah.
the important things to learn.
Mm.
And this change of system has done something over the years. The older doctors don't have the time. They just don't have the time because they have to work,
Mhm.
because you have like, and that's like really something that is specific to surgery. The more you operate, the more money has the hospital, and so they have to operate.
Yeah.
And in many hospitals, big hospitals where you have the big cases, it's just about operating. It's not about teaching,
Yeah. The more
because teaching takes time. Like,
time. Exactly.
yes, and nobody has the time.
Yeah.
And so
And also,
that's That's one thing about
and
it.
also the rule that you cannot work more than 48 hours or like per week and more than
There's the
24 hours
law.
per that law.
Yes.
I think that also has impact that they pay you overtime. Like if you stay 1 hour extra,
Yes.
you demand that I will stay 1 hour extra, I need overtime, or I
Yes.
want that 1 hour free. So from the resident side also, there is this demand of equality and of as you people work as employee, basically don't work as a student.
Yes.
Yeah.
Yes.
So
That's the thing.
yeah, so when you have
Wonderful.
that,
Wonderfully said.
yeah, when you have an employee mindset, then the employer is going to have employer mindset. Okay, you stay
Yes.
for 1 hour, you will get 20 euros, 30 euros, whatever, and you are done. So
Yes.
but if you stay like a student, then they will might be like, okay, you are a student, now you are here to learn, then I will teach you. So I think both ways, there's this
Yeah.
law that has also an impact on this thing. Don't you
Yeah.
think
But
so?
I do think that you've decided, like you've decided to do this thing because you like surgery, because you want to be something. Some many people want to be good surgeons also. Many people that I talk to, and you're doing it, and time goes by. And I do think if I can change the culture, if I can change the system, then I can change myself. And that's what I did myself. Because I tried like pushing on the outside, but it didn't bring anything. So I started pushing on the inside and pushing myself to new boundaries, so that, okay, there is no time, but how do I get really good so that I can work in the time they give me? And that was my journey for the last 6 years, specifically in Germany, trying always to work on the things that I can change, so that I get to be taught, I get to be pushed, I get to be the person who is like given the surgeries, I get to be the person who is yes, as I think, who gets trained. Like, I just wanted to be a really good surgeon. That was really very important to me.
And would you
And
like to share some of the strategies or the ideas, because many of our audience are young surgeons and doctors. Some are in training, some are still not yet in
yes,
training. So,
yes.
would you like to share some tips and ideas with us?
So the first thing I learned from a chief of surgery in a course I was in 2018, I think.
Mm-hmm.
So bear in mind, I was like 2 years in Germany, and I was like chronically, how do you say it? Like disappointed,
Okay.
because I was a very good surgeon as I came from Iraq.
Mm-hmm.
I did operate on open heart in a
Mm-hmm.
year. I reached this level, and then I came to Germany, and then I went with one of my senior senior surgeons, and like for 3 months he gave me nothing in the operation room, and so I was like, for a long time I was like chronically disappointed. And then I met this chief surgery, and I asked him, and he told me, you have to change your mindset. And you don't just wait for people to give you stuff here. We don't do it that way. You're just gonna have to take responsibility for your training, and you're gonna have to ask. You're gonna have to ask. And this was like really not easy to me, but it is the way it is in Germany. You're gonna have to ask, can I please do that? Would you please give me this? And if the
Mm-hmm.
people say no, you're gonna have to say, okay, but what do I have to do so that you give me this operation, this part of the operation? But
Mm-hmm.
I think the first and most important thing is to understand that you are responsible for your training here. There are no boards. There is nobody. There is this wonderful video from Mel Robbins. I
Mm-hmm.
don't know if you know her.
No, I don't know
Uh,
her.
had a wonderful speaker and writer, and she says in this video, no one's coming.
Ah, yeah,
And this
yes,
is
yes, yes.
this
I
video.
know.
Yeah.
Yes, I know that. I did not know her. First time I noticed that. When you hear Robbins, then it comes. Tony Robbins comes to mind, but Mel Robbins, yeah, I
No,
saw
Mel
that video.
Robbins.
Yes, yeah.
Yeah, and it's just like that in training. Nobody is coming. You're gonna have to take responsibility. You're gonna have to plan your training. You're gonna have to look for the important books, for the important trainings, for the important courses, and then you're gonna have to do them also. And you're gonna have to control your progress and just plan everything better. and you can do it. I do know I have a very good, like, I myself don't have a bad experience, but I just see around me people who are like suffering because they're not reaching what they want.
Yeah. See,
And I had to do a lot of things to get to the level that I got to.
this nobody is coming concept is actually relevant in all walks of life. So
Yes.
you have to be active. What I understand is from what you want to say is that you have to be active. You have to take your
Yes.
responsibility that this is your career, your life, and if you are active, it's not that the system is against you. Nobody's against
No.
you, but
No.
they don't also care for you. It's not their
Yes.
responsibility that they have to train you. Like
Yes.
in, for example, in India, when we have like mentors, so there the mentor, it is his like matter of pride that my
Yes.
resident, my doctors, I will train them so good, then they will go out and they will say that I have been trained under this doctor.
Yes.
Okay. Here, that is
Yes.
not the matter. Here, you can
Yes.
spend your time, you earned your salary, you go home, and nobody cares where you have
Yes.
trained, and nobody asks you where did you train. So it's your career and your life.
Yes.
So
It's wonderful that you said that because for me too, in Iraq, there are two institutions.
mhm,
There is hospital,
mhm,
hospital doctors, and there is teaching doctors who
mhm,
belong to the university. They get
mhm,
paid to
yeah,
teach.
mhm,
This doesn't exist in Germany.
yeah, yeah,
And so it's just like you said, they don't hate you. They're not bad people, but I was in this position too. Like I love to teach. I
mhm,
really love to teach. But I got to the point like when you get good, you have so many things to do. You
yeah,
don't have time to teach other people. Like
exactly.
I was in this point. I was like, and I was like, I'm doing right now the things that I said that are bad or that are not to do because I don't have time. As soon as you get good, you get like a lot of jobs, you have a lot of things to do, and you don't have time to teach. It's the way it is.
Yeah. So that is what is important, that one should not understand it like this, that you will not get the chance or they will not give it to you. They will give it to you if you're worth it.
Yes.
You have to
Yes.
prove that you're worth it. That,
Yes.
yeah. So you have to increase. It's not like what happens in, for example, in India. Okay, for example, now because of my consulting, I talk to different people. I talk to several specialists who, after being specialists in India, now want to come to Germany or have already come to Germany. Like I'm doing this
Yes.
consulting for a few years now. So I talk to them very candidly. I say them, see, you are. If I was a specialist somewhere, I would not think of moving to a new country, learning a new language, and making everything like from a start. I would have stayed there because India, from business point of view, it's a big country. There's lots of opportunity over there. So why do you like? Why do you want to do that? And how was your training? I talked to them about training as well. So they tell me that they have operated a lot, but still, I have not come across a surgeon who has been like 3 years, 2 years, 3 years post PG, who has said that, okay, I have done extraordinary things, or I have done. They say that, okay, here also we have done more. Number is more, but then they are not satisfied by the quality of it. They are not satisfied by the protocol that has been followed. They're not satisfied the post-operative care for that. So there are matters of dissatisfaction everywhere. Okay,
Yes.
so there they are not satisfied with what they do over there. So this is about the surgical hands-on. And there, what happens is that if you're enrolled in particular institute after getting a rank and the exam and all, then now 3 years you'll be there. There is nobody else to do it. So you have to do it, what is to be done. So
Mm.
you automatically train over there. So there is no
Mm.
choice that you can be passive. You have to be active over there because you're working 24/7 over there. Here,
Yes.
what happens is that here you can choose to be passive. If someone says that I just want the title of a fakats, I don't want to do hard work, I don't want to operate, I just want a title and I want to basic salary. You can
Yes.
This is possible in Germany.
Yes.
If you're passive, that will happen to you. That you will become a fakats, you will get a basic salary, and you'll not be able to operate because not because nobody gave it to you, because you did not want it. You did not want it bad enough to put the hard work.
Yes.
Yeah. So this is what I find the difference between like the system in India and like in Germany. to be very honest, I have seen doctors like at where I'm working. They're just fakats now. Okay, they are just fakats.
Yes.
They're 1 year post fakats, and they can operate better than me. Realize I try to find out why is it happening. What in the
Yes.
Besprechung, on what points they speak and I don't speak. Okay, when there is a particular case, what do they do? How do they prepare for it? How do they prepare the patient? How to when they see a patient in the note of nama, would I have done everything that this person has done, or would I have said that okay, fine, this will leave it? Like, do I have that? In India, we call it chalta hai mind. So chalta means it's okay. Like,
Yeah.
so how dedicated am I as dedicated as that person?
Yes.
First, my aim is not to get all the operations that that person is getting. My aim is to become as dedicated as that person is.
Yes.
Because when
Yes.
a consultant, when the Oberarzt tell that person that okay, some job, okay, then that consultant is sufficient, like satisfied that this will be done, okay.
Yes.
And if he gives you that job and he has to ask you 3 times that did you do it, did you do it, that means he does not
Yes.
trust you.
Yes.
And when he does not trust you, then it is difficult to get anything from him or her.
Yeah.
Yeah. So that's why,
And
yeah.
I do think that both of you have a better experience.
Hmm, hmm,
Like if you are this person that you're talking about, the dedicated
hmm,
person, then you have a better experience, and your consultant has a better experience. And I do think that with my work, I can create this experience.
yeah, yeah,
And
yeah.
in my head, there are two people who are benefiting, but everybody's going to benefit, and these are the residents and the
Hmm.
patients,
Yeah,
because it
indeed.
hurts me so bad when I see depressed residents who
Hmm,
are not getting what they want,
hmm.
treat patients not adequately the way they deserve. I do think that patients deserve to be treated well.
We have discussed a lot about the German system, the pros and cons, your experiences, my experiences. I'm trying my best to get other doctors also on my channel. I recently posted on Facebook that other doctors who are already working, if they would like to come on this channel, share their experience so that we can have a collective. Because you work in a particular hospital or have worked in a hospital in a particular part of Germany. Have my
Yes.
limited experience. When we get more and more people, the more and more problems can be found out.
Yes.
Okay, that what are those problems, what are they facing, and when the problems, finding the problem, that is the first step of finding a solution,
Yes.
right? So I have posted it. Let's see how many people respond to that. I mean, so far I have received only a couple of responses. The thing is that that is also one thing I want to mention, that when you have a job, right? When one foreign doctor, especially people whom I mostly know, I know mostly foreign doctors in Germany, like Indian doctors especially. So one comes to Germany, has a job, like a stable job, has a salary, lives in a Germanized life in a good environment, everything. They become more complacent. That fire that one has before coming here or during their training, that okay, I want to become this, I want to become this. That fire is somehow, yeah, okay, fine. It's a lifelong process. I will become a surgeon 30 years after working 30 years. That do you think that that is also one reason that people, because of the complacent, and they see this environment everywhere. Everybody is behaving the same way. Okay, you want your urlaub, you want your Wochenende frei, you want like you're getting a regular salary. Then even when you are a less good surgeon, you will be getting the same salary. Then why do you put that extra hard work?
Yeah. I don't think this is a special thing about foreign doctors or doctors or surgeon. I do think this is a human thing.
Mhm, mhm,
Like I've heard and read that many times. Most people die at 30 years of age to be buried at 60 or 70 years of age. Like they give up everything and they just want to live. But they don't live, in my opinion. They just exist there. And
yeah.
yeah, that's like a human thing. Many
The
humans give up
purpose
on everything they dreamt about.
is the purpose, the meaning of work. That is not. I mean, I was also reading something recently, and there it was said that the work that you do every day, that is not necessarily the meaning of your life or meaning of what you want. You might want to do something, and you are very fortunate that if that is similar, like if your meaning of life is helping like patients every day, and then you are a
Yeah.
doctor and you go to hospital,
Yes.
then you're in best life. Okay.
Yes.
Then that fire, that engagement will never stop, because that is the
Yes.
meaning or that's the purpose of your life. I believe thus such people become the best surgeons, because the motivation does not have to come from outside, it is already
Yes.
inside. And this exuberance of these motivation, this also is seen when you talk to such people, their seniors, their consultants, their oberats. When they talk to such people, I'm sure they would be finding such motivation coming out of those people. And what do you
Yes.
think? Will these people not get chance to operate? Will these people not get the opportunity to move ahead? Definitely, I think they will.
I just do have a wonderful story
Yeah.
about that, what you're talking about. I always talk to patients. Like I don't only talk to patients asking where's your pain, and I talk like to patients as humans, and I get to know them. I find it very interesting, and it gives my day some joy. And I asked once one patient, "What did you work?" And he said, like he's an older person, and he said, "I used to work as a bus driver." And I was like, "Tell me something good about being a bus driver." And he was like, "What's better in life?" And I was like, "What do you mean? You drive buses?" And he was like, "Yeah, it is amazing. I used to drive cars every day and get paid for it." He got like excited. This old man got like really excited about his life driving buses. It's just like you said. It's his meaning of life, driving people, getting people to where they want to go. And that with driving cars, it was amazing for him. And that
Wonderful.
made life wonderful for him. And yeah, that's what I think also about.
Yeah, that's
If treating patients, being with patients, operating makes you happy,
hmm.
then this happiness, this energy is definitely it's a wonderful thing. It gave me a lot of chances, and it opened a lot of doors for me. And people helped me, and they gave me operations. And um, honestly, one of my consultants told me like he was just trying to convince me to stay.
Mhm.
He told me like you're one of the few people who I would have let operate on me. And this is like
There's
only
a big
like being
compliment.
happy. Yeah, that's like really big compliment for a surgeon who's like 63 years old. He's about to retire in the next years, and he tells you that. And what did I do? I just be nice and work hard and be nice to people, and that's what I did.
Yeah.
You definitely get a lot of doors open if you're nice, but
Yeah,
definitely not only that.
that is not the only requirement. I mean, that is one of the requirement. Obviously, nice and good and hardworking, all those factors, which you will
Yes,
be also. You have been saying those things. I watch your videos regularly, and I find it very motivating.
thank you.
Even when I am like little bit ahead in Weiterbildung than you are, I still find your videos very motivating. That okay, if I had seen these videos when I was like when it was someone who was 2 3 years elder than me, or like ahead of me in my career, had made such things, such motivated things, then I would have had a different mindset right from the beginning. i
Yes,
I made one video recently. It was in Hindi. I was talking to my people in India, and I was saying that the things that I learn, I'm 30, almost 36 now,
yes,
and things that I learn now, the mindset that have developed over last 2 3 years. If I
yes,
had this mindset at 25, 26, 28, life would have been totally different.
yes,
Life would have been totally different.
yes.
Not not
I
only
agree.
career wise, your personal relation wise, finances wise, every way
Yes,
life would have been different. But then, as they say, it's never late to learn. Like uh,
yeah,
that's why I said that okay, fine, let me not regret about what has not happened 10 years back, but be glad and happy that at least I have come to my senses now in last couple of years, and I'm trying to
yes,
develop myself and evolve myself into a better, more intelligent human being, and not just existing and trying to live. Yes.
yes,
So with this, With this idea, Madhi, tell us what is the plan further? What is going on? Like, what are you going to do career-wise for yourself now?
Um, right now, I feel I have to do something um, about this system, because these are people that I really love, and I mean residents in surgery and patients, and I do think I do think that residents in surgery are like really smart people, and they deserve to get there where they want to. And so I want to help them get there. I want to help as many residents in surgery to develop the mindset and the skills needed to be the best in their training, and to get these chances that they want to, and to have a better experience. And don't lose the time.
Yeah.
Don't have this mindset of I'm gonna start training after my training ends, because in my mind, the problem is after you finish your training, who's going to control you? Who's going to tell you that if you don't learn to control yourself, to control your results? And that's what I want to do. I want to start teaching, and I'm starting right now to teach residents, coaching one-to-one, and teaching them everything I learned and everything I experienced in the last years as a doctor, as a surgeon. And yeah, that's what I'm doing. That's what I
Great,
want
great.
to do.
I'm sure like people would be very happy to have certain because see there are a lot of institutes which offer like specific objective things like okay, echo course, ultrasound course, this course,
Yes.
that course. This all businesses are there, commercial aspects are also involved there. So that is fine. I mean, that's not bad. Like if you cannot learn ultrasound in your school or in the hospital, you go to this course and do that. But the motivation that you have to go and learn this, that nobody's going to tell you. That nobody's going to tell you that, okay, you need these things to become a better doctor. You need these things to do. And this will come. First, one thing that happens is that people do it like copying each other. That, okay, this colleague is doing this, I will also do that.
I will also
But
do
if you,
that. Yeah.
yeah, I will also do that. But if you don't have any such people around you, there is no own initiative, own idea that okay, I should do this. People think that okay, fine, my training has to be in the hospital. Whatever I'm doing in the hospital is fine. What I'm not doing is also fine. Like, okay, fine. Yeah. So that additional thing. So I think your training will will sensitize people, will
Yes.
give them the channel that okay, how like everyone wants the end result. They want to want to become good doctor or good surgeon,
Yes.
but they first of all don't know what are the steps involved.
Yes.
Yeah. And when they also know steps involved, when they watch some serial movie, they see that okay, how are good doctors, what do you have to do? But then they don't have that motivation to do those steps because that steps is hard. As you
Yes.
said in the beginning, that everyone wants a good physique, a healthy body, and they also
Yes.
know that you have to train for that and go to gym and run every day. It's not that you don't know that, it's only that you don't want to do that.
Yes.
It's hard to get up in the morning and go for a run or go to the gym. So
Yes.
once someone has to be there who does this push also, that okay, it
Yes.
has to be done.
That's a very interesting example. It's also, the thing is, we think that it's really hard. Like for someone who's like overweight,
Mhm.
they do think, because think about it, why are they overweight? They do think that it's really hard and painful
Mhm.
not to be overweight. But if you take the time to learn about the things and understand, like I've invested a lot of time the last few years in learning about health and body.
Mhm.
And right now, I don't do many extra things. I train 20 minutes 2 times a week, but this is not the beginning. It took me 3 years to get there,
Mhm.
to get to this, to knowing like these important things. And that's what I intend to do. You don't need to wait 10 years to know this one thing that will change everything for you. You just can learn right now. And I do think when people learn it right now, that they are going to be able to achieve amazing results. Because it's just like you said it. If I knew what I know today, 10 years ago, where would I be? I would be like crazy good.
Yes.
But I didn't know it. And that's why I want to teach it to other people so that they know it and don't lose time.
Yeah. The reason why we did not know it was that people, first of all, less people taught it. And
Yes.
second reason is that we did not know that it's important. We need to know it. So
yes.
that one realizes after the time is already like a little bit, not past, I would say. I mean, we are still young, but still, I consider myself still young. But
yes.
still,
you are.
it could have been done a little sooner. Anyways, so yeah, I mean, it's very nice talking to you, Madhi, with so much insight about the training. And I'm sure the people who are watching our channel now, they would also appreciate what you're doing. And if they have doubts, if you have doubt, people, I'm talking to the audience, if you have doubt about anything that Madhi has talked about, or if you have any suggestions, questions, anything that you want to clear it up, then write in the comment section. We will try to answer everything through video or through writing, like response to your comments. All right. So, Madhi, do you have anything to say to our viewers who are like mostly doctors who are just about to begin? Anything, any 1-2 sentences that you want to say? Or
could it be more than 2 sentences?
if only if they're interesting.
I want to share something with you, because you talked about it like a couple of times. You said like, I'm 36, I'd like to think that I am young. I just want to share something that blew my mind the last few years. So about everything that we know about reaching goals in life, it's been made like 30 or 40 years ago. Back then, people used to die at 50 and 60 years. But it's not that way anymore. So what we are seeing is most of the people, like at least in Germany, live until 80 or 90 years old.
Yeah.
And so to think that at 30 years you have to achieve this and that, it's not the way you do it today. And so I've learned new way to calculate your age. And so it says that your life starts at 25. At 25, you're 0. And so you are, Deepak, 11 years old.
Okay.
Yes, you're 11 years old. And you still have time, because these 20 years are the years of training, of Vorbereitung. What do you call it in English?
Vorbereitung.
Yes. Preparation.
Yes.
You have 20 years of preparation to get to 45. And if you use these 20 years good, then you still have, by the age of 45, good 40 to 45 years to live. But if you throw these 20 years away, then your life with 45 start to disintegrate, and you have 2 options. Either you're going to die early if you didn't take care of yourself and your things, or you're going to live, and that's the way we see it in hospitals, but a bad life, a life with no quality, where you do nothing. Yeah. And so that's why I wanted to share, because many doctors come to Germany and think, I came at least to Germany and I thought like, I'm too old. I'm like, and everybody here told me like, you're too young. And I was like, no, I'm like really old. And then I understood that you still have time. Everything is good, but just work on yourself. These are 20 very important years for the people who are in these years. Work on yourself, concentrate, be clear about the things that you want to achieve in life, and go for it.
Totally second the thoughts that Madhi has told me. Last month, I was reading a book, Ikigai. Ikigai is a book which is about it's a small book about the longevity of Japanese people. They have also spoken about the meaning of life, the purpose that you have. How do people live longer and still have better lives? It's not like as a dement patient of 100 years who has no quality of life, has no thought. Not like that. A good, healthy, long life, and how can they contribute to the society? So that's a very
Yes.
interesting book. Like I would recommend to everyone who is watching this. That's one book I have it in my Audible, and yeah, that's a. I mean, I'm trying to, I'm rereading it, taking chapters from that, and trying to implement that in my life. Like, how can I implement that book? So that I mean, this is how, when I told you that I'm learning new things. These are the ways of listening to different people, reading different books of different mindsets, different ideas, different concepts. So this awakens you basically
Yes.
as a person. And when you are awakened as a person, then you think, how do you spend your most of your day? Most of your day as a surgeon you spend in your hospital. Okay, then you're awakened in that also, that when you are doing particular thing for most of your day, it makes sense to put more hard work in that, be more aware and more present in that work.
Yes.
Because
Yes.
if you are doing like you're doing more, that is the main work. So why would you be more awakened in other branches and not be in that? So that will be more like fruitful for you. So I'm
Yes.
still working. I'm still a student on these things. I'm still working on these things. I just wanted to share it while we're having this conversation. All right. So,
Yes.
Madhi, thank you very much for taking the time.
Thank you.
Very insightful conversation. Not just the on my channel, I talk mostly about dry data, like information. That this do this step one, do language, do approbation, do this thing, and we don't talk very often about the mindset, the evolvement, the improvement. Those things I don't talk much. But I hope viewers will like that. This change of pace, and I hope that they will like and subscribe to this channel as well.